Hello, 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 YouTube world. It's Miss Patty with 4YourCNA, and we are here for another exciting edition of our CNA practice test game show, where you get the opportunity to answer test-like questions and compete for real-world prizes. So thank you guys for joining us. When you come in, just give me a quick hi or hello in the chat so that I know you're here. I will go over the rules of the game and explain how it works for those of you who are new. Those of you who have attended before, welcome back. Okay, so we're going to go over 15 practice test questions. And these questions are going to be from this topic. Nope, this topic over here. Basic nursing care. Now, this is the biggest category on the written test. So the majority of questions that you're going to get on the test are going to come from this category. And what you're going to find is a lot of this category is going to deal with emergency situations. So as CNAs, we know that we do normal, and anything that doesn't fall into normal gets reported to the nurse. But in an emergency, we don't always have the time to get the nurse's attention. So we have to know what to do in an emergency to make sure that the patient is safe and receiving the appropriate care. So that's what today's questions are going to focus on. So the way this works is I'm going to show you the question on the screen with 4 answer choices, and you're going to type into the chat the number that you want to choose, either 1, 2, 3, or 4. Type it into the chat, hit the send button, it sends it to YouTube. I have a program that sits on top of YouTube and reads your answers and awards points. Now remember that the order that you see the comments may not always be the exact same order that they came in onto YouTube because, you know, internet latency and things like that. So my program is going to read when it gets accepted by YouTube. And it awards points. The quickest answer gets the most points. And it will put you on a leaderboard at the end of the game show, at the end of the 15 questions. We will determine who came in first, second, and third by adding up all those points, and we award prizes. So first place prize is this t-shirt. It says Become Inspire Care. So so you get a t-shirt. We'll find out what size you are. I've got some new t-shirts coming out very shortly. I've got a really cool one for the holidays that will be the first place prize for our next game show, so stay tuned for that. That's a really fun one. And second place prize is the card game, which is this, the card game. And third place prize is a badge holder. And you can't buy these, the badge holders, you actually have to win them. So they're kind of like a badge of honor. All right, let's see who's here. Juliana, good morning. Hello, Jessica. Hi, Latrina, Latasha, Chrissy, Laquandra, Andina, Joan, Helen. Hey, Helen. Hi, Faith. Hi, Lee. Hi, Delise, Cecilia, Karen, Faith. All right. So we got a lot of people on today. Now, please be aware that I can only send prizes to the U.S. So my shipping doesn't do international. So I can only send prizes to the U.S. So please keep that in mind. Anybody outside of the United States, you're more than welcome to participate. You just won't be able to get the prize. So keep that in mind. So is everybody ready to get started on the game show? Oops, oh, hold on. Oh, I forgot to do something. Hold on 1 second. Let's see if we can get this. There we go. Okay. No. All right, so we're going to get started here. All right, we're ready. Remember, you'll see the question. I'll read it to you. And you will put in the chat the numbers 1, 2, 3, or 4. Don't put anything else and only vote once. Here we go. A patient complains of nausea and dizziness and becomes unsteady while being ambulated. The CNA should, 1, go find the nurse immediately. 2, ask the patient if they want to lie down and rest. 3, assist the patient to sit on the floor. Or 4, rush the patient back to a chair immediately. So a patient complains of nausea and dizziness and becomes unsteady while being ambulated. The CNA should, 1, go find a nurse immediately. 2, ask the patient if they want to lie down and rest. 3, assist the patient to sit on the floor. Or, oh, hold on a second, guys. I'm going to stop this for a second. Can you guys hear me? I'm seeing a couple of people say you can't hear me. Can you guys hear me? If you can hear me, say yes, please. If you can hear me, please say yes. Okay. Left channel only. Yes, yes. Okay. All right. I'm not sure what's going on with, turn this up just a little bit maybe. Can you guys hear me better now? I'm not sure. Hear me better now. Faith, you might want to go out and come back in. All right, so let's get back. I guess, okay. So I guess my sound is working. All right, so here we go. The right answer here is to assist the patient to sit on the floor. And the reason for this, now this gets really confusing for students, for CNA students. You can't leave a person who's dizzy, nausea, and unsteady. So 1 is not going to be the right one. Ask if they want to lie down and rest doesn't do anything to improve safety on the walk. And rushing the patient back to the chair, guys, if they aren't tolerating a slow walk, they are not going to tolerate a rush. So we have to keep that in mind. Safety is always going to be a priority when it comes to emergency situations. And this would be considered an emergency because they are a fall risk. So the best way to handle this is to help the patient sit on the floor, because somebody that's sitting on the floor can't fall on the floor. So Jessica, Wait, and Rosdanya came in the top 3. All right, so we're going to go on to question 2. You enter an ambulatory patient's room to help them to the dining room and find the patient unresponsive. You would, 1, ask another CNA if this is normal for the patient. 2, leave the patient to find a vital sign machine. 3, check for breathing and pulse immediately. Or 4, evaluate if the patient is over-medicated. So you enter an ambulatory patient's room to help them to the dining room and find them unresponsive. What do you do? So go ahead and type in your answer. Go ahead and type in your answer. Yeah, and if we have an unresponsive patient, the first thing we have to do is check to see, do they have a heartbeat and are they breathing? Because if not, we have to start CPR. We can't wait. CPR has to begin immediately. So, asking another CNA, it tells us they're ambulatory. We don't need that information. Leaving the patient, never a good option. And evaluating if the patient is over-medicated, that's not our role. So the right thing here is to check to see if they need CPR. So Jessica came in first on that one, followed by Andina and Neo. Good job. Good job. All right, question number 3. A normally cooperative patient suddenly becomes combative while you are providing care. An appropriate response would be, 1, is this causing you pain or discomfort? 2, what's wrong with you? 3, you know I have to do this skill before lunch. Or 4, why are you being mean to me? I'm only trying to help. So a normally cooperative patient suddenly becomes combative while you are providing care. An appropriate response would be, is this causing you pain or discomfort? What's wrong with you? You know I have to do this skill before lunch. Or why are you being mean to me? I'm only trying to help. The right answer here is this causing you pain or discomfort? Patients that are normally cooperative that suddenly become uncooperative, there's usually a reason for it. Either they're in pain, they're uncomfortable, They don't feel safe in some way. So we have to stop and kind of look at how we're providing the care to see if there's something that we can do better to make that patient more comfortable. So Wait came in first on that one, followed by Jessica and Faith. All right, question number 4. A patient has become increasingly confused over the last week. The CNA knows that 1. Patients have to listen to CNAs even when confused. 2. Confusion is often present during an infection. 3. The patient is developing dementia. Or 4. CNAs only report confusion if they think it's important. So a patient has become increasingly confused over the last week. The CNA knows that. Go ahead and select your final answer. Select your final answer. Correct answer here is number 2. Yeah, confusion is often present during an infection, particularly a urinary tract infection, but any infection can cause confusion in the elderly. So if we have a patient that hasn't been confused, that is now becoming confused, that is the first thing that we need to do, is look for some sort of an infection somewhere. So yeah, confusion is often present during an infection. So I'm going to pause this for just 1 second, guys. Give me just a second. I need to fix something here. Hold on, I'm sorry. I just need to fix something. Okay. All right. Okay. So are you guys ready to go on? Here we go. Question number 5. Jessica came in first on that one, followed by Nia and Dina. I just gave us a little more time for the questions and the answers because we didn't have enough time there. All right, here we go. Question number 5. A measure the CNA can take to assist a patient who is having trouble breathing is to 1. Position the patient on their side. 2. Limit fluid intake to prevent CHF. 3. Ask the patient if they would like oxygen. Or 4. Assist the patient to a sitting position. So a measure a CNA can take to assist a patient who is having trouble breathing is 1. Position them on their side. 2. Limit fluid intake. 3. Ask if they would like oxygen. Or 4. Assist the patient to a sitting position. Go ahead and lock in your final answers. You have about 15 seconds left. All right. A lot of answers there. About 5 seconds. There we go. Now we're not rushed. All right, yeah, we're going to assist them to a sitting position. When somebody is having trouble breathing, I'm going to take a deep breath here. Atmospheric pressure is going to press in on the chest cavity, the lungs, the muscles, the ribs. When you lean forward or sit up, it helps relieve some of that gravity and atmospheric pressure and allows those lungs to inflate a little bit more. So certainly we're going to let the nurse know, but before we leave this patient, we have to take a step, implement some measure to help assist their breathing while we leave to go let the nurse know. So putting the patient on their side doesn't really help with breathing. It's not our job to limit fluid intake or to assess if they need oxygen, not our role. Jessica came in first on that one, followed by Andina and Wait. Good job, guys. Most of you guys got that one right. I'm super proud. All right, moving on. Question number, I think we're on 6. Here we go. A patient lying on their back in bed begins to vomit. The CNA should, 1, rush the patient to the bathroom immediately. 2, turn the patient onto their side. 3, immediately go get the nurse. Or 4, scold the patient for not telling you that they felt sick. So a patient lying on their back in bed begins to vomit. The CNA should rush the patient to the bathroom immediately, turn the patient onto their side, immediately go get the nurse, or scold the patient for not telling you that they felt sick. What do we want to do here? You got about 15 seconds left. Go ahead and lock in your final answer. And the correct answer here is 2. Now, this is when we would turn the patient on their side. So the last question was asking about breathing difficulties. In that case, the patient needs to be sitting up. But when we have a patient lying on their back in bed and they're vomiting, that's an aspiration risk. So we need to get them turned onto their side. Rushing them to the bathroom may not be, they're already vomiting. That may not be the right response here. Immediately go get the nurse. You're leaving the patient vomiting, lying on their back. That is not the right answer, ever. We never leave a patient that's in distress, especially in a safety situation. And scolding the patient, that is never the right answer, ever. Remember that we are there to help adults. We don't scold adults. Jessica came in first, followed by Wait and Andina. Good job. Good job. Remember, a lot of the questions on the state exam are going to try to make sure that you're not going to treat an adult like a child. All right, next question. A patient with a fever becomes unconscious and begins to jerk violently. The CNA should, 1, remain with the patient and ensure their safety. 2, ask the family if they have a history of seizures. 3, restrain their extremities to prevent injury. Or 4, apply a cool cloth to their forehead. So a patient with a fever becomes unconscious and begins to jerk violently. The CNA should, 1, remain with the patient to ensure their safety. 2, ask the family if they have a history of seizures. 3, restrain their extremities to prevent injury. Or 4, apply a cool cloth to their forehead. Go ahead and lock in your final answers. You have about 5 seconds left. The right answer here is to remain with the patient and ensure their safety. This patient is having a seizure. Now, it could be due to the fever. It could be due to something totally unrelated. We don't know. Not our job. What we need to do is ensure the patient's safety. So we're going to remain with them. We should time the seizure so when the nurse comes in, we can give them that information. But our whole goal here is to ensure their safety. Make sure their head doesn't hit anything. Make sure that they don't break an arm or a leg by hitting it on a immobile object. Asking the family if they have a history, not our job. Restraining, never restrain somebody who's having a seizure. And applying a cool cloth to their forehead, that's not going to help the seizure or help with safety. So Jessica came in first, followed by Wait and Neo is third. So good job. All right, question number 8. A dementia patient has very red skin on their hands that is beginning to blister. The CNA is unsure what happened, but should, 1, scold the other CNAs for not watching the patient better. 2, tell the nurse what they think caused the burns. 3, submerge the hands in ice water for at least 30 minutes. Or 4, run cool water over their hands. So a dementia patient has very red skin on their hands that is beginning to blister. The CNA is unsure what happened, but should scold the other CNAs. 2, tell the nurse what they think caused the burns. 3, submerge the hands in ice water for at least 30 minutes. Or 4, run cool water over their hands. So 5 seconds left. Lock in your final answer. The right answer here is to run cool water over their hands. This is basic first aid for burns. You do not want to submerge a burn in ice water. Nothing super cold. It should be cool or lukewarm. What we want to do is gradually reduce the temperature of the surface that's burned. You do not want to scold the other CNAs. That's not your job. And we don't want to tell the nurse what we think caused the burns because that doesn't do anything to take care of the patient's burns. Certainly we'll notify the nurse that a burn happened, but it's not really our job to speculate what caused it. And Most importantly, this doesn't do anything for the patient. Remember that questions are going to focus on the patient. So Wait came in first on that one, followed by Rose and Jessica. Good job. Yeah, that was a tricky one, wasn't it? That was a hard question. Question number 9. A CNA is feeding a patient who has been coughing during meals. The CNA knows that this could indicate 1, an aspiration risk, 2, a food allergy, 3, an unwillingness to eat, or 4, fluids must be restricted. So a CNA is feeding a patient who has been coughing during meals. The CNA knows that this may indicate 1, an aspiration risk, 2, a food allergy, 3, an unwillingness to eat, or 4, fluids must be restricted. Yeah, this is a little bit tougher type of question. You got about 15 seconds left. Go ahead and lock in your final answer. Go ahead and lock in your answer. The right answer here is, drumroll, number 1, an aspiration risk. So when you're feeding a patient, we need to pay very close attention if they start coughing a lot. Because when they start coughing, it's letting us know that the muscle tone of the esophagus is not working properly and the food is not being directed down into the stomach adequately, which means it could go in the breathing tube or the trachea, and that poses an aspiration risk. So anytime a patient begins coughing while you're feeding them, it always has to be assessed by the nurse. So you would stop feeding this patient because they're an aspiration risk and get the nurse for further evaluation. So Jessica came in first on that one, followed by Wait and Latasha. Good job. Good job. Most of you guys got that one right. Coughing does not indicate a food allergy. So those of you who chose food allergy, that's not a sign of a food allergy. All right, a patient's face begins to droop on one side, their speech becomes slurred, and they're unable to move one arm. These changes may indicate 1, the patient is overtired and needs to rest. 2, the patient may be having a heart attack. 3, the patient may be having a stroke. Or 4, the patient has suddenly become diabetic. So a patient's face begins to droop on one side, their speech becomes slurred, and they're unable to move one arm. These changes may indicate 1, they're overtired and need to rest. 2, they may be having a heart attack. 3, they may be having a stroke. Or 4, they have become suddenly diabetic. Go ahead and lock in your final answer. You have about 5 seconds left. And the right answer here is they may be having a stroke. And these are symptoms that we all need to know because time is essential when your patient is possibly having a stroke. There are methods that we can use to help limit the severity of the long-term consequences of a stroke, but they must be implemented in a very short amount of time. So if you notice these symptoms, drooping of the face, slurred speech, one side of the body isn't moving properly, you must report that right now. We have to know these signs inside and outside so the patient gets the right care that they need. Having this patient lie down and rest is going to delay treatment and could lead to long-term consequences. Diabetes never occurs suddenly, so that word suddenly is not appropriate. Jessica came in first on that one, followed by Wait and Latasha. Good job. All right, moving on. I think we're on question number 11. An elderly patient develops a skin tear on their arm that is bleeding profusely. The CNA should, 1, tape the skin tear closed with surgical tape. 2, apply a liquid bandage to the area to close the skin tear. 3, apply an ointment and gauze dressing to the wound. Or 4, apply pressure until the bleeding stops. So an elderly patient develops a skin tear on their arm that's bleeding profusely. The CNA should tape it closed, apply a liquid bandage, apply ointment and gauze, or apply pressure. Go ahead and choose your answer. You have about 15 seconds left. Go ahead and choose your answer. This is basic first aid, and you will have some questions on basic first aid on the state exam. The right answer here is to apply pressure until bleeding stops. Absolutely. That's for any bleeding. Any bleeding. Doesn't matter what age the person is. If it's bleeding, it gets pressure. We don't want to tape it closed. Now, skin tears occur when the skin is very, very thin. If you put tape on very, very thin skin, when you try to take the tape off, you're going to take the skin with it. We never apply liquid bandage. That is not a CNA job at all, because whoever's applying that liquid bandage has to assess the tissue underneath to make sure we're not locking in things that could hurt the patient later. And we don't apply ointment and gauze over the wound when it's still bleeding. We want to hold pressure. So Jessica came in first on that one, followed by Wait and Miriam. Good job. Good job. All right, moving on to question number 12. You enter a room and find a patient on the floor. They are conscious and state that they fell. Your first action is to 1. Help the patient off the floor. 2. Check their vital signs. 3. Look for broken bones. Or 4. Stay with the patient but send a coworker to get the nurse. So you enter a room, find a patient on the floor. They are conscious and state they fell. Your first action is to 1. Help the resident off the floor. 2. Check their vital signs. 3. Look for broken bones. Or 4. Stay with the patient but send a coworker to get the nurse. Now pay attention to the wording of this question. It says your first action. That means that all the actions are probably appropriate. They're asking for what's going to come first. Got 5 seconds left. Go ahead and lock in your final answer. And the right answer here is stay with the patient and send a coworker to go get the nurse. Remember, we never leave a patient in an emergency situation. You can't leave that patient. We don't want to help them off the floor because we don't know anything about their injuries. Checking their vital signs could potentially be a good step, but not until the nurse has assessed them. Looking for broken bones, again, it might be a logical step, but not until the nurse has assessed them. So there's other 3 actions we're probably going to take, but only after we get a nurse to take a look at the patient and make sure the patient is safe for those actions to occur. So 4 is your right answer. Jessica came in first on that one, followed by Nadej and Rozdanya. So yeah, that one was kind of hard, wasn't it? This week I'm giving you questions that are a little bit harder, and they're questions very similar to what we're going to find on the state exam. You are caring for a diabetic patient who has not been eating well. The CNA should 1. Offer frequent snacks to improve intake. 2. Notify the nurse of your observations. 3. Ask the family to bring in their favorite foods. Or 4. Begin feeding the patient in his room. So you're caring for a diabetic patient who has not been eating well. The CNA should 1. Offer frequent snacks to improve intake. 2. Notify the nurse of your observations. 3. Ask the family to bring in their favorite foods. Or 4. Begin feeding the patient in his room. Go ahead and lock in your final answer. You have about 10 seconds left. This is a really important question. Really important. All right, the right answer here is to notify the nurse of your observations. When we have a diabetic patient, we are going to manage their food and their medications very, very strictly to make sure that we're giving them the right amount of medication, whether it's insulin or oral medication, to help offset the carbohydrates that they're eating in their food. So we really want to make sure that they're eating all of their food and we're managing their medications properly. If they're not eating their food, we have to reevaluate those medications. Offering frequent snacks, Not a good idea, because again, it's going to affect the medication that we give them. Asking their family to bring in food, same thing. And begin feeding the patient in the room, that just isolates the patient. They're not going to eat very well. So we want to notify the nurse of our findings. So Jessica came in first, followed by Rosdanya and Renata. Good job. Yeah, managing diabetic patients takes a very well-integrated team effort. A patient is coming back from the dining room and begins complaining of mild chest pain. The CNA should, 1, notify the nurse and get vital signs immediately. 2, ask the patient what they ate. 3, tell the patient to chew an aspirin immediately. Or 4, give the patient an antacid and reevaluate in 30 minutes. So they're coming back from the dining room. They begin complaining of mild chest pain. What should we do? 1, notify the nurse and get vital signs. 2, ask them what they ate. 3, have them chew an aspirin immediately. Or 4, give them an antacid and reevaluate in 30 minutes. Go ahead and lock in your final answer. You have 10 seconds. What do you want to do here? Again, this is emergency management. So we're going to notify the nurse and get vital signs immediately. This patient may possibly be having a heart attack. They may also possibly be suffering from indigestion. We don't know, and we can't make that determination. We need to get the nurse and vital signs to help manage this situation. The nurse may have the patient chew an aspirin immediately. That is something that the nurse is going to do. So this question is also identifying if you understand your scope of practice. Super important. All right, good job on that one. Good job. Asking them what they ate doesn't do us any good. Wait came in first on that one, followed by Jessica and Chrissy. Good job. All right, I think we have one more question to go. You enter a patient's room and find them lying on the floor, unresponsive, without a pulse or signs of breathing. You should, 1, look for injuries, bleeding, or broken bones. 2, go get the nurse immediately. 3, yell for assistance and begin CPR immediately. Or 4, check the patient's chart for a DNR. So you enter a patient's room, find them lying on the floor, unresponsive, no pulse, no breathing. What do we want to do here? Do we want to, 1, look for injuries? 2, go get the nurse immediately. 3, yell for assistance and begin CPR. Or 4, check the patient's chart for a DNR. Go ahead and lock in your final answers. You have about 10 seconds left. This is a hard one. I got answers all over the place. The right answer here is number 3. We're going to yell for help and we're going to start CPR right away. We do not delay. No pulse, no breathing. Requires CPR right now. Going and getting the nurse doesn't do anything to help this patient. We're going to yell for help and start CPR. Looking for broken bones, this guy doesn't have a pulse or respirations. Broken bones are the least of our concerns. And we aren't checking the chart for a DNR. If your patient has a DNR in place, that DNR only applies to the condition that is expected to end in death. So this is an emergency situation. If the patient had a DNR, you would know that they have a DNR during report. Jessica came in first, followed by Neo and Renata. You guys did a really good job on these questions today. Some of these questions were a little bit harder, and remember, these are the types of questions that are going to make up the majority of the questions you're going to have on the state exam. So Jessica came in first on that one, followed by Wait and Neo. So Jessica, Wait, and Neo, you are going to send me an email to 4YourCNA@gmail.com. Jessica, I need you to give me your shirt size as well. And we'll get that, let me put this up here Sorry, guys, I just now have to type all this in. There we go. So first, second, and third place winners, you're going to send me an email to claim your prizes. Jessica, you want to send me your shirt size as well so we can get that shirt out to you so I can make sure that I get the right size for you. And, oh, Andina, you received your shirt. Awesome. So Andina got our first shirt. So you're matching me. Cool. I have got several shirts in the works. And we've got some new prizes that we're going to have coming up after the first of the year as well. I'm working on that. So first place, Jessica, you are going to get a t-shirt. Second place is going to get the card game, and third place gets our badge holder and a motivational gift as well. Thank you guys so much for joining us today. I am super happy to spend this time with you guys. This is like the highlight of my week. This is so fun for me to be able to hang out with you guys and present questions in something a little more engaging than just boring questions on a page that, you know, you're kind of sleeping through as you're going through. I like to do things that are a little bit more engaging, a little bit more fun, and we want to make sure that we're giving you the why behind the answers. It's not enough just to get the right answer. You have to know the why behind it to really make you effective in the workplace. So thank you guys so much for hanging out with me. We do this on the first and third Tuesday of every month, so I hope you join us in 2 weeks at 11 a.m. Eastern. So it'll be right before Thanksgiving. And we have a lot to be thankful for. So for those of you who have not yet, go out and vote. Go out and vote. Make sure you get your vote in. Doesn't matter who you're voting for, just make sure you vote. Miss Patty says. All right. Marie says, have a great day. Very interesting. Thank you. Chrissy says, this is very fun. Oh, thank you guys. Awesome. All right. So I'm going to go ahead and sign off because I am going to go vote. So until next time, guys, we will see you in 2 weeks for another game show. My live classroom session is tomorrow at 9 a.m. Make sure you catch that if you have a chance. You can always catch the replays on flcnatraining.com. Let me put that in the chat for you as well. flcnatraining.com. You can catch our replays of our classroom lectures, and that will help you if you're getting ready to test as well. Anybody that's getting ready to test, best of luck out to you. We send you great vibes, and we hope to see you in an upcoming live session soon. Until next time, happy caregiving. Bye.